So, firstly, thank you very much for joining us. I was hoping you could just tell our listeners a little bit about yourself and give us a bit of an introduction.
Yeah, my name is Andrew Dawson. I'm a headache specialist. I've been so for more than 20 years. I started off doing research in headache and then became the director of the headache service at King's College Hospital and helped to set up services as a network into King's for the region. And about 10 years ago, which is relevant to this particular area geographically, is I set up a service for the East Kent area, which is based in Margate and in Ashford. And that's one of a number of services that I lead. I'm also part of the clinical lead for the MSc for the professional groups in headache, which is based in Edinburgh.
I was hoping you could tell our listeners some of the sort of symptoms of migraines and also how they kind of differ from headaches.
You're quite right in thinking that, symptoms are important in sort of making a diagnosis. Migraine tends to have lots of features and symptoms. So one-sided throbbing, worse of activity, moderate or severe rather than mild, nausea, light and sound sensitivity, smell sensitivity, lethargy. These kind of things go with migraine. And the more of them you have, the more likely you are to have migraine. So more than 3 probably will put you into the migraine group. Whereas the ones who are featureless tend to be the episodic tension type headache. So the migraines are the ones that are disabling normally, and the tension headache's more of a nuisance.
So, how often are people likely to suffer from migraines? Is it quite a lot or sort of spread out?
The amount of migraine that people have varies from person to person. It can vary in the same person during their life. So the average is probably about 10 a year, 1 a month about. Some people get them once a year, other people once a week. The danger of having the higher frequency once a week or 2 days a week affected is that the uncontrolled headaches or the painkillers used to treat the headaches can lead to even more headaches. And that's called analgesic dependent headache when it's involving the painkillers. And we have an epidemic of that in the UK. So, the very thing you're using to treat your headaches gives you even more. And that's a real problem for us in terms of the clinics.
Well, I was going to ask about that, about treatment and, how that can work or what are better ways to treat it.
So in terms of management, most people start off with episodic headaches. So they have a migraine that lasts a day or two, then a gap, then another one. And the mainstays of treatment for the episodic is firstly non-drug approaches, then rescue drugs and preventative drugs. So the non-drug approach might be if you can identify a trigger and avoid it, so you don't have to have the attack in the first place. Or it might be lifestyle, so trying to regularize eating and sleeping and exercise. They may reduce the numbers of attacks. And then for rescue, there's 3 sort of elements that might be brought together to work best in the patient. So paracetamol is usually not quite as good as the ibuprofen type drugs, but early use of those type of agents alongside something that allows them to absorb better, like metoclopramide, a prescription drug that helps the stomach to empty, and or a drug which is specific for migraine, like the triptans. So they were launched in the 1990s, and combinations of those 3 will often work better than individual drugs alone. If you're getting to an attack a week, you need to be thinking more about preventatives. And there are some non-drug approaches like the supplements, B2, magnesium, CoQ10, and there are the prescription drugs the doctors give you, beta blockers, topiramate, candesartan, and then there are preventatives, which are sort of devices. And although there's a number of them, the one we've had the best success with in my clinic is one called Cefaly, Cefaly.
So are painkillers sort of a short-term cure, but long-term cause more problems?
You're quite right. Painkillers are a bit of a double-edged sword. So if you had once a month migraine and took a painkiller and it always worked, the chances are that will be fine. But the danger sign is if your numbers are going up. So the number of days affected or the number of doses of painkillers is actually rising. So if you find that you're taking 1 dose and it clears your headache, I wouldn't be concerned. if you're using one dose, but it becomes you need a couple of doses or 3 doses, or you're finding that rather than once a week, it's becoming more frequent, that's when you need to be seeking care to see if you can identify other options for treatment.
I was going to say, so you shouldn't just sort of almost self-diagnose you're getting migraines. You should be sort of seeing somebody to make sure that is what you're suffering from.
Well, we actually developed a questionnaire a few years ago now where we looked at those main symptoms that we discussed at the beginning. And when we had those as the core of the questionnaire, when patients applied them to themselves, they were actually pretty good at making a diagnosis. When they realized it was the sort of feature full symptoms that we were looking for. There's a bit of the disconnect came with people not seeking, when they started to lose control, they weren't seeking additional help from some sort of professional. So it might be a nurse in a practice who's got an interest, or it could be the GP. If the GP hasn't got all the tools available, maybe they'd refer you on to a specialist centre like we have in East Kent. But you need, if you're doing well, you don't need those people. If you're not doing well, you need to kind of recruit some more people to help you.
Was there anything else you'd like to sort of cover or get over to our listeners that we've not yet covered?
I think you've covered most. Do you want some helpline or kind of further information sources?
Yeah, that would be useful.
Okay. So if people were wanting to look at some more information, the patient organisation over the last 20 years has been called Migraine Action Association, and they're now working under the with the Migraine Trust under the same umbrella. So if you were to search on Migraine Action Association, it would lead you to the kite-marked websites. If you wanted more information about the device I mentioned, CEF-ALY, just search on that and it will take you to their website.
Well, I'd like to thank you very much for taking the time out to talk to me.
Okay, thank you.